WURD Radio on Demand, 96.1 FM and 900 AM WURD, streaming live at WURDradio.com.
I have a very special guest here with us this morning that are going to talk about something that every woman needs to know about, particularly those of us who are African American women, because this is a situation that affects us disproportionately. And we are talking about fibroids because July is Fibroid Awareness Month. And we are joined by Real Housewives of Atlanta star Cynthia Bailey, along with Dr. Katsnelson, who is a specialist when it comes to fibroids and many other things as well. Thank you so much for joining us this morning. How are you today?
I'm doing great. Thank you so much.
Yes, I want to start with you, Dr. Katsnelson, because I know that you are a specialist in fibroids and some other things as well, but fibroids are one of the things that you work with. Tell us exactly what are fibroids and who is most at risk for getting them?
Fibroid disease is the most common condition that women suffer. Up to 80% of Black women by age of 50 and up to 70% of white women by age of 50 develop fibroids. And 60% of Black women by age of 30-35. And fibroid disease is basically, it's benign tumors that grow. They're not cancerous, but they grow and they compete with the body, with the babies for space and blood supply. Can be 1, can be 20, can be small, can be as a grapefruit. And what they create is basically 2 groups of symptoms. One is because of bleeding, because they irritate uterus so much, they grow in the uterus, they irritate so much that women bleed a lot. All the time, very prolonged and heavy menstrual periods, sometimes bleeding between the periods, leading to weakness and anemia and many other things. Inability to wear white, there's many different things. The second group of symptoms because of the pressure. It's a pressure on other organs, like a small bladder. Women need to run to the bathroom every 20-30 minutes, or have a constipation, or like a baby bump, or just pain during the sex. So all the symptoms are extremely common, can be a variety of combination of the symptoms. And interesting to know that most of the time women either suffer in silence for 10-20 years, or they get treated with the surgeries that can be preventable, myomectomy or even hysterectomy. 1 out of 3 women get hysterectomy, basically removal of the organ that makes woman. And that's in a nutshell what is fibroid disease.
Now, is this something that impacts women all the way through and past menopause, or is this just something that impacts women who are of childbearing age?
That's a fantastic question. Because of the size, they don't shrink after menopause, and they continue to irritate. So the pain during the sex, compression on the other organs, it all stays. And many symptoms, I would think that majority of the symptoms will get better, and some do after menopause, but many women benefit from the treatment when they come to us for uterine fibroid embolization, which is minimal invasive through like a needle hole here, 1 millimeter needle stick under local anesthesia, and we thread the catheter toward the origin entrance of the blood vessels that feed the fibroids. Basically, we clog the arteries, starve the fibroids, and they shrink. Whether it's during the younger age or after menopause, when we shrink because of lack of blood supply, the fibroids, they just get absorbed by the body.
Cynthia, let me ask you, you have been open with your battle with fibroids, and what is it that made you feel that you could be this honest about your struggles?
Well, as a reality star, I always just try to live in my reality, live in my truth. And I was suffering the most from my fibroids when I was full-time on the Real Housewives of Atlanta. That's when the symptoms were really just out of control. And I felt like I could not share my life without sharing that part of my life. And to Dr. Jan's point, it affects so many African American women, and so many of the ladies on the cast of The Real Housewives of Atlanta at that time also suffered from fibroids, but it wasn't hot and sexy to talk about fibroids. So I just felt like, as someone who's always just tried to live in a very authentic space and a very honest space, this is part of my story. This is a part of my journey. And not only am I living this in real life, I really thought to share it on television as well, on the show, which is, by the way, one of the best things I did on The Real Housewives of Atlanta, because I cannot tell you, anywhere I go in the world, how many women come up to me after sharing my fibroid journey on The Real Housewives of Atlanta, how it inspired them to go get their situation checked out, to get, the information they needed. I educated them about UFE, Uterine Fibroid Embolization, which is so easy to get. It's so non-invasive, invasive. Literally you do it in the next 2 days, you're back at work. Or depending on the woman, it's very individual how people process pain and how they heal. But it was literally one of the easiest things that I've ever done, and the best thing that I ever did, because again, to Dr. Young's point, so many women suffer in silence. Nobody wanted to talk about fibroids, and thank God, I feel like I really opened up the door for other celebrities to start having the fibroid conversation.
I know that you, and thank you so much for detailing that, but I know that you have shared this on the show. Do you mind telling us how this impacted you personally and what your symptoms were like?
Okay, absolutely. With my fibroids, I think my biggest one was maybe the size of an orange, but I think I had 2 or 3 of them. And for me, I always had very heavy, painful cycles. My periods were just crazy. I could never wear white. I was always bleeding all over the place, no matter how much protection I put down there, how many times I changed out. I was always at risk of bleeding out. I was definitely anemic. I was literally pulling over on the side of the road to try to find crushed ice all the time. I was an ice maniac because I was anemic during that time when I was dealing with my fibroids. Love life, sex life, definitely affected me. Sometimes it was very painful to actually have sex, if I actually felt like even having it, because I was so tired all the time. And, I think when you have all these different things going on, it kind of puts you in a dark space. It's not fun to just be, bleeding most of the month, and you have maybe 1 week, 1 week where you actually just are normal. And, just all those things. As a woman who's busy, I'm an entrepreneur, I have so much stuff going on all the time. So for me, it just really made everything so much more difficult than it had to be.
And how courageous of you, because as a public figure, first of all, something that is painful, something that is embarrassing, and then as a public figure, always having to constantly worry about what you're wearing and
all of those things.
Yes.
And going back to that, as a public figure, I always stayed on the celebrity baby bump list. People always thought I was pregnant because I was always bloated from my fibroids. I was always had this bump because they were inside of me. So I was always explaining to everyone, no, I'm actually not pregnant. I have fibroids. This is why I look like I'm 3 or 4 months pregnant. And, that got exhausting, just even having to continuously have that conversation.
And so I'm assuming that you have had the UFE process, and so has that relieved the fibroids, and are you now in much better health and spirit now that that's happened?
Absolutely. I had UFE probably about 8 years ago. I can't remember, but it's been a while. And it was the best thing that I ever did for myself. It was honestly life-changing. I probably, after even the first month, I saw a difference in my periods. I went from being on my cycle for 10, 12 days sometimes to 3 days. And, just mentally, emotionally, everything changed. I was no longer anemic after I had UFE. I don't know if this is for everyone, but I wasn't bleeding as much. So that went away. I got my life back after UFE. I literally got my life back, my quality of life. And I think that we all deserve to be able to live a quality life. And I think as women, sometimes we do so much and we put ourselves last so many of the times, because it's just how women are. It's important for us to put ourselves first and put our wellness first. And I'm really glad that I did that for myself, because it honestly did change my entire life and a lot of the lives of other people who was able to hear my story and see my story and, do what they needed to do if they were also suffering from fibroids.
Dr. Katsnelson, can you explain to us a little bit more about UFE, the process, and how women can, if they are dealing with these symptoms, find a path to being helped?
That's an excellent question. A much happier story than we just heard. And thank you, Cynthia, you're a true champion. And I believe every woman deserves the best version of her life. And that's what we're trying to do. So 70-80% of women will have a fibroid during their life. If you suspect this because of the symptoms, either bleeding or pressure, ask the next thing to do, ultrasound. It's transvaginal, transabdominal ultrasound, 10-15 minute study, and we can actually see. We see this fibroids in the size of grapefruit or small size. We'll see them. Then we get prioritization from insurance. Those treatments covered by insurance. We might check blood, or sometimes if woman is 40 and above, we do uterine biopsy or pap smear if woman didn't have it for 3 years, just to make sure there's no other reasons. And that's it. The procedure itself is outpatient in the office. Women come and in 10-15 minutes, IV, light sedation. The procedure itself takes between 15 to 45 minutes, sometimes a little faster, and sometimes a little longer. It depends on anatomy, and the woman doesn't feel anything. And between 30 minutes to 2 hours after completion of the procedure, a woman usually go home. And they have a cramps. Some women tolerate very well, and it's very light. And some, it can be discomfort, like a bad menstrual period for 2, 3, 4 days, and that goes away. The biggest things about UFE, it's outpatient, and it's covered by insurance. You don't need to, very short recovery. But the biggest thing, in my opinion, is you can give lives. You can have a normal pregnancies, because one of the biggest symptoms of your fibroids are miscarriages, right? If you have something big that competes for blood and space with a baby, miscarriages are very, very common. And after hysterectomy, you will not have children. And then having normal babies, we call it fibroid babies, and we have plenty of those. And actually, Dr. Schuyler, that works in Philadelphia, Prince Philadelphia, Southampton, is like, he has his count. Every time we have a woman that come with a baby to the office after UFE, he just texts, calls everyone, takes a picture, because it gives a huge meaning to our lives as a physicians, as an organization, USA Clinics. It's we have almost 170 locations in 30 states, like 39 locations only in New York City. And we do this magical transformation of old medicine with surgeries that's existed for 100 years to minimal invasive through needle hole, that we can fix the problems much better, much easier, outpatient. And it's new, although it's been around for 25 years. But if you go to gynecologists do surgeries. And who knows about interventional radiology specialty? No one. So I think our mission is to connect women that suffer with the specialists, magicians, interventional radiologists that can do it, this UFE treatment in the office, and give the best version of the life to every woman.
So you should start with your gynecologist, get an evaluation, as you said, and
you can come to us. You can come to us straight. You'll call usafibroidcenters.com, usafibroidcenters.com online schedule, or just call us from the website. We'll do it all. We'll do at the same visit. We're going to do ultrasound, we're going to do a biopsy, pap smear, blood work, everything. You'll have a diagnosis, care, everything in one place, one time, very efficient. And so you'll have a diagnosis instead of You come to one doctor, they send you to a bunch of tests, then in 3 months you come again. We'll just do everything in the right place in one time and make it this easy. We just try to imagine if you're the patient, how you want to be treated. And that's kind of the burden that we need. And because it's our organization, we don't depend on hospitals or anybody else to make it happen 100% within our control.
So USA Fibroid Centers is a national group of centers that specializes in the treatment of fibroids, and so people have the option to go there.
From A to Z.
Got it. Thank you. Cynthia, I've got to ask you before I let you go, what's next for you? Real Housewives, or there's so many different spin-offs in different shows. What's happening? What's up next?
Everything. I will be returning to the Real Housewives of Atlanta, Sweet 16 season 16.
Wonderful.
I'll be coming back in a official friend capacity. My acting career is still my priority. And, lucky for me, we were able to work it out around my schedule where I was able to pop in and out and hang out with the ladies, at my convenience. So that really works well for me. And you guys saw me on this season of BMF, which I was super, super proud of. I played my first lead in a BET Plus movie called Who's Cheating Who? That's coming out this year. I'm doing some behind the scenes stuff. I have a show on Hulu coming out. That's a reality show this year. So I have a lot going on. I'm staying the course. I'm so excited to really just be living my best life right now, honestly. And I'm also very proud to still keep the conversation about fibroids going. Although I no longer suffer from fibroids, I'm really proud to be a brand ambassador for USA Fibroid Centers, because I still think, although there's a lot more information out there and people are talking about it more, we still have to keep the conversation going and going and going and going. So just excited to support women and anything to do with, women's health and wellness. I'm a huge advocate to help women be great.
So booked, busy, and now healthy. Thank you so much, Cynthia Bailey, Dr. Yan Katsnelson, USA Fibroid Clinics. That is an option for people who are suffering with fibroids. Thank you so much for bringing that to our attention. July is Fibroid Awareness Month. And if you are someone who is suffering, and suffering being the operative word, please check out Cynthia Bailey, where we can find you on socials. I know you have information there. And then Dr. Yan Katsnelson, USA Fibroid Clinics. Thank you so much for being with us on Reality Check today. We appreciate it.
Thank you.
Thank you, Tonya.